Okay, hi, my name is Malachi, and today we're going to be doing we're going to be doing the medication administration practice. Okay, so I've already done my calculations, and we're going to be doing 20 milligrams of furosemide, which calculates to 2 tablets. And I have that right there. I don't know if you can see it. We have 10 milli equivalents of potassium chloride, which is calculated out to 1 capsule. Have that separated right there. And then we're going to be drawing up 5,000 units of heparin, which is about half a milliliter. I've already calculated that, so we're going to do that now. And we're going to be using a 25 gauge 5/8 needle with a 1 milliliter syringe for this. And a blunt tip filled needle to initially draw. We're going to take the alcohol out, alcohol pad. Clean the site here. I'll leave that right there. Syringe. Okay, right there, take that, pull back 5 milliliters of air. Inject the air. Some air bubbles. Okay. Scoop and snatch method. Attach the needle. And just so you can see, I have half a milliliter in there. And we already have the label right there, attached on there. Okay. Okay. So now I'm ready to go into the room and see the patient. Hi.
Hello.
My name is Malachi. I'm going to be your student nurse for today. Can I please verify your name and date of birth?
Annie Leduc, November 30th, 1992.
Okay. We're going to start out by getting some hand sanitizer out here right now. Okay, so now I'm going ahead and log into Sims chart. Okay, we'll go to MAR right here. And I'm going to verify your MRN number with your wristband right here. Okay, and that matches up. Okay, so first things first is I'm gonna go ahead and get a full set of vitals, okay?
Okay.
The doctor has ordered for 3 different kinds of medications, so after we get our vitals, I'm going to go over a little bit of information before each shot, and I'm gonna ask you if you have any questions before each shot.
Okay.
And then afterwards, we're gonna proceed with the medication, okay? So, if you would open your mouth for me, please. Here's your temperature. If you would hold your arm straight out for me, please. You know your baseline?
120.
Okay, so we're gonna pump it up to 150. Okay, so it's about 118 over 64. Temperature is 98.6. So let me go ahead and get your radial pulse here. So could you hold your arm out like this? Okay, so we got a pulse of 64, and we got a respiration of 14. And are you experiencing any pain today?
No.
Okay. So now I'm going to go to the MAR. Go ahead and pull up the first thing we're going to do, which is going to be the heparin. So pull that up, and I'm going to correspond the heparin, the patient's scan number with the scan number on the actual medication itself. Here we got the green verified mark. Okay, and just for some teachings, so I'm about to give you your heparin shot, which is a subcutaneous shot, which means it's going to go right back into the back of your right arm right here, okay? Mm-hmm. Some of the side effects include fever, a rash, just some important notes. Are you currently menstruating right now?
No.
Okay, so that's very important. You don't want to be menstruating when you're taking this medication. So if you do start to menstruate, you need to make sure you let your provider know. And then some other information, just switch from a harder toothbrush. If you have a hard toothbrush, switch to a softer toothbrush so it doesn't cause your gums to bleed or anything like that.
Okay.
Okay? So now I'm going to go ahead and put my gloves on. Go ahead and clean the site for 30 seconds. Okay. So I'm going to pinch, bevel up, 45-degree angle, go in. Hold for 5 to 10 seconds. Pull out, release. Okay, and then dispose of in sharps. Okay. So I'm gonna go ahead and next, potassium chloride. Okay, so you can set this. Okay, so next we're going to be giving your potassium chloride, 10 milli equivalents, which comes out to 1 capsule. Just so you know, some side effects include nausea, vomiting, cramps, or diarrhea. And just for some teachings, you want to avoid any over-the-counter salt substitutes, any antacids, and avoid, I don't know if you have this problem, but avoid eating too much licorice. And then after this medication after you stop taking this medication, you want to be sure to include more foods that have that have potassium in them, like bananas and such. Okay.
Okay.
You got any questions for me?
No.
Okay. So here's potassium chloride. And here's your water. Thank you. Okay, so now, can you get over the camera? So now 7:30. Okay. Okay. So next and last is our furosemide. Okay, so now you can go and set it down. Okay, and so finally, for our last medication, you're going to be getting 20 milligrams of furosemide, which is calculated out to 2 tablets. Some of the side effects include loss of hearing, nausea, and rashes. And just for teaching purposes, you need to take this earlier in the day. You need to take with food because it can cause nausea, and it does cause some potassium loss. So you need to eat foods that are high in potassium, which is like bananas and stuff, just like the other medication.
Okay.
So, yeah. You have any questions for me?
No.
So here you go. Here's some water. Thank you. Okay, saved. So now I'm going to go up here to vital signs. Go ahead and put in the vital signs. Pulse was 64. Respiration was 14. Blood pressure was 118 over 64. Okay. Just go double check. Sure all that stuff saved. Okay. Now I can shut it down. Okay. So today you have been given your 3 medications, the furosemide, the potassium, chloride, and heparin. Do you have any questions for me?
No.
Okay. And just remember, if you start to have any complications with these medications, like any of the side effects that I mentioned to you earlier, reach back out to the clinic, and the nurse or the prescriber will get back to you. Okay? Thank you.
Thank you.
Wash my hands and have a nice day.
Thank you.